Hi Jim, my name's McKenna. I'm going to be your nurse today, and the main point of this visit is going to be going over the lab values that we have drawn from you, which are the liver function lab values. Do you have any questions, or do you know anything already about any of these lab values? Alright, perfect. So we're going to start with the AST levels, which the normal range for men in this is going to be 14 through 20, and the whole reason for this test is used to evaluate liver and heart disease. And some signs and symptoms you can look out for increased or decreased levels of this is going to include fatigue, weakness, jaundice, and abdomen pain. Also some muscle weakness and fatigue for that one. The next lab value is going to be ALT, and the normal range for men in this is going to be 10 through 40. And this test is typically used to detect liver disease and monitor course of treatment with hepatitis. Some signs and symptoms to look out for this is going to be some jaundice, some dark urine and loss of appetite, as well as fatigue and signs of weakness. The next one we're going to be going over is ALP. The normal ranges for adults in this is going to be 52 through 142. This test is typically used as a liver and bone disease index when put together with other clinical findings. Some signs and symptoms to look out for increased or decreased levels of ALP are going to include jaundice, bone pain, itchy skin, as well as tingling and numbness and muscle weakness. The next one is going to be direct bilirubin, and the normal ranges for this are going to be 0.0 through 0.3. This test is used for evaluation of liver function and hemolytic anemia. Some signs and symptoms to look out for increased or decreased levels of direct bilirubin are going to include jaundice, dark urine, pale gray stools, and sometimes with decreased levels of this, there can be no abnormal lab values, but mild fatigue and signs of liver dysfunction. The next one we're going to be going over is going to be total bilirubin. The normal range for this is going to be 0.3 through 1. This test is also used for evaluation of liver and hemolytic anemia. Some signs and symptoms to look out for increased or decreased levels of total bilirubin include yellowing of the skin and of the eyes, itchy skin, overall low red blood cell turnover, and signs of metabolic issues. Alright, moving on to albumin. The normal range for this is going to be 3.5 through 5.2, and this lab is typically used to evaluate nutritional status, albumin loss, kidney disease, liver disease, hemorrhage, burns, and another plethora of other diseases. Some affecting factors include pregnancy with this, which you won't have to worry about. Increased and decreased levels, some symptoms you'll see will be an experience of dry mouth and skin, thirst, reduced urine output, swelling, edema, and difficult wound healing will happen with decreased levels of this. And the final one we're going to go over today is total protein. The normal range for this is 6 through 7.8. This test is used to measure all the protein in the blood. So some symptoms to look out for include thirst, joint stiffness, fatigue, swelling, muscle wasting, and brittle hair and nails. So if you experience any of those, let your healthcare provider know. Alright, so those are all the lab values that we went over today. Do you have any questions regarding any of these? Alright, thank you so much for your time, and I hope you start to feel better.